Well, hello, everybody. Hank Linderman here. Yep, I'm fixing things. Trying my best anyway. Well, welcome to Getting Angry. And have a close look at this picture. You may wonder what that is, this human being who's there holding his cell phone. And, and by the way, yes, everybody's sharing. Thank you. That's how an angel gets their wings. Roy Frazier is back. Yes, it has been a bit hectic, hasn't it? Well, this picture came from the event I was at this week with Amy McGrath. And Amy had a gathering in Elizabethtown. And as I got there, I spoke to some of her staff, and they said, see the guy over there in the black shirt with the camera and the black ball cap? He's a tracker. So that's a tracker from the Republican Party who I guess is keeping track of Amy McGrath. And they said, because you're a candidate, you just want to be aware he's there to cause grief for everybody. I guess that's when you know you've made it as a candidate. You know, I'm running for Congress here in Kentucky's 2nd District. That's just south of Louisville, goes on down to Bowling Green. And from Owensboro across to Danville. Thank you all for sharing. Listen to all those harps playing. What a wonderful thing. I got so many things to talk with you about. This is, of course, the last day of the week for me to be doing this. And I don't know where to begin. There's just so much to talk about. We could have some fun first, I suppose. You know what? I'm going to play you a video. We'll do this later. But I think I've shared with you the video from the Juice Media. And that's an Australian group of young people that do these really on-the-money, fun videos. But they use naughty words. So our dear friend Rich Campbell, who's working with the campaign, made a version of it that took out all the sweary bits. So this will be a version you can share with your family if you would like to do that. I'm so glad to see all of you here. I guess it's time for us to look at some numbers, eh? Did that the wrong way. Someday soon, maybe next week, I will have a camera up that shows you all the buttons that I have to push and all the things I have to keep straight. And I'm also going to put out a camera because I miss being able to see the lake every so often. You know, I'm in this room from the secure, undisclosed location. And I think it would be nice to be able to get a look at the lake. So I'll get that together by Monday. And also remember Monday, Congressman John Yarmouth from Louisville, from the 3rd District, is going to be with us and talking for 15 minutes or so. So I'm really looking forward to that. Hildegard says, oh, shucks, no cussing. Well, you can find the naughty one all the time, but I'm sensitive to the idea that, look, I'm already leading you down the path here, making you look at that video. Anyway, back to these grim numbers. You know, this carries on and on. It's like Groundhog Day, isn't it? We have passed over the grim milestone of 170,000 dead, 170,415. We're approaching 5.5 million cases, which is just incredible. In another couple of days, we should hit 5.5 million. Nobody else is even close to us. Just look at this. Just dreadful. Here's the top 10 or 12 or so in the states. California remains in the lead with the most amount of new cases this week, but hot on their heels is Texas. Notice that New York still has the most amount of deaths, and New Jersey, I believe, is second. They got hit very early, of course, and didn't handle it as well as they could. So anyway, that's that sad news. Cindy says, Dr. Greg was awesome yesterday. Yes, he was.
Greg Adams, good Dr. Adams. Ask Dr. Greg.
I just wanted an excuse to play Randell's theme music. So anybody working on Dr. Greg's T-shirt yet? We'd like to see that. His mom would like to see that. So this is a look at Kentucky. You notice Kentucky's right in the middle of the page there. And 741 new cases is on the high side for Kentucky. So we are having difficulties in Kentucky even controlling this. And I believe a lot of this is the result of people not wanting to wear their masks. I mentioned yesterday I went out for gas, and the nearest gas station is closed down. And then the next nearest one had a problem. Their pumps weren't working. So I had to drive 10 miles to get gas back and forth. Raymond Bowling is here. Raymond wants to know about the guitar hanging on the wall. We'll talk about that at some point. Anyway, we still are not accepting the idea that we got to wear masks. And even though hopefully future President Joe Biden has asked everybody to wear masks when they're outside, the other thing we have to be clear is when you're in a public space indoors, you need to wear the mask as well. There appears to be an issue with air conditioning. If you're in an enclosed space with air conditioning, that appears to be related to exposure to the virus, which is not a great thing. You know, as we try to figure out how to deal with this virus, I've been the advocate of going Godzilla, meaning that we pay money for people to stay home. Your job is to stay home. It'll be a bargain in the long run. If we pay people to stay home, that will be a bargain, because that will be the quickest way to get the economy back at full steam. Roy Fraser says multiple guitars. Yes, there's clearly more than one. Anyway, going Godzilla means we pay adults, we pay Americans to stay home. And honestly, we've just got to pay everybody to stay home. We can't have any sick people wandering around. And my guess is that as little as 4, but probably closer to 8 weeks, we could have this virus shut down. This is what Canada did. Canada now is having events in stadiums. They don't have to wear masks while they're outside, and they leap onto any new cases and deal with them. And that is a way that we could deal with this, because as Dr. Gregg told us yesterday, we're not really going to be safe until there's a vaccine. The quickest vaccine in history previous to this, we don't know what this one's going to be, but the previous quickest time of making a vaccine was for the mumps. That took 4 years. So this is the only thing we can do, is protect ourselves. And we can't count on all of our neighbors to protect us either. So it sucks, but you got to wear a mask when you're out in the world. You've got to avoid, when you go to the grocery store and you're indoors in the air conditioning, you've got to wear a mask. You got to wash your hands. Got to do all these things, and that will help protect you and your family. Let's see, where are we at here? Let's move on. So this is a story that's listed as TMI, too much information, and it begins with a tweet, which looks like it's from, is it Neera Tanden? Neera Tanden says, you might want to check out the death rate in France before you think their form of healthcare system is the answer. And actually, things look a bit different. Early on, it looked like Republicans and Democrats were not ready to say, centrist Democrats at least, were not ready to say that Medicare for All was a good thing for you. And early on, in fact, we had people saying, would you rather be in a hospital in Italy or a hospital in the United States? And the implication was that Italy would be much more dangerous. And there was some comment to indicate they thought that this was an indictment of a Medicare for All system. There are other factors, of course. That's not the only factor, but the situation is completely reversed today. As we know, America has lost control of the system and of the pandemic. Part of that is because people don't want to go get treated. And we'll get to some of that. I'm going to skim through some of the text of this, but I would suggest that you look up this article and read it, because it is very, very informative. In fact, let me show you the chart. I'll get my face out of the way. Deaths per million, and you'll notice that the United States is all the way at the top. The rest of the countries have a single-payer system. Now, we're also showing that even in the United States, we're seeing support for Medicare for All. And by the way, even outside of Europe, countries with national healthcare programs, they have outperformed the United States as well. For example, Taiwan, which does have single payer, added 20 new cases and no deaths in July. By the way, Taiwan's system is especially interesting because it was partially designed with the help of Dr. Reinhardt, who was from Princeton University, and he was an outspoken critic and source of wisdom for dealing with healthcare in the United States and across the world. He famously had a bit of a temper, and someone asked him, do we have to cut pay for doctors? And he said, let's talk about that. Doctors represent 10% of your costs. Let's cut their pay by 20%. You've saved 2%, and now you've convinced them, you've taken away their incentive to help you. So he said, no, we don't need to cut the pay of doctors. Not that there aren't some doctors that need to be brought into line, I'm saying, but in general, that's not where the expense in healthcare is. Taiwan redid their healthcare system a while back, and in terms of percentage of their economy, it's significantly lower even than France. We are the most expensive. We're at about 18, pushing 19% of our gross domestic product, and we also spend about double what other countries spend. France, for example, is at around 12%, I believe, 11% of their GDP, but Taiwan is more like 7%, and they cover everyone in their country. So it's quite a difference. New Zealand is also a single-payer country. They declared themselves COVID-free in early June. On Tuesday, they recorded their first locally transmitted COVID case in 102 days. Notice that even though they've gotten rid of the virus, it does pop up every once in a while. So it's not like once you wipe it out in your country, that's the end. We're still going to have to stay active on it. We lead the world with active cases of more than 5 million, despite the fact that other nations are conducting more tests. President Trump thinks if you test more, you're going to find more cases. Well, guess what? Other countries test more. We still have the most. Pardon me, drying out. Less than half of the U.S. states are seeing a decline in infections. We lead in the number of deaths with now over 165. Oh, are we over at 170? I think we're over 170,000 deaths. Yes, how terrible is that? Pardon me. I may have to get a drink of my drink here in a few minutes if I keep drying out like this. Now, public support for Medicare For All, a single payer, has swelled in April. They found that Medicare For All has the support of 87% of Democrats and 69% of independents. Now, even MSNBC host Joy Reid, and she's been a critic of Bernie Sanders, and she'd been a past Medicare For All skeptic, says she can't think of one good reason today to keep our current system. And there's no question about that we do need to, my opinion, we are going to have to go to Medicare For All. So far, Joe Biden is resisting the calls to do that, but I think there's not going to be any choice. 360 delegates, by the way, next week at the Democratic Convention, there are 360 delegates that are going to be opposing the platform if it does not include Medicare For All. So that should be an interesting battle next week. Also, many doctors are in favor of single payer. We didn't ask Dr. Greg. Oh, that's all I need. Let's talk to Dr. Greg next week about single payer. Maybe that would be a great subject for us to discuss with him. Hildegard says she wants the vaccine. Oh, Mark Andes is here. So glad to see you, Mark. Let's get back on here. This is from the president of Physicians for a National Health Program. It's an American group that supports single payer and says cost barriers to healthcare are making the crisis worse. Quote, the pandemic is laying bare the lethal inequality of American society and American healthcare. COVID-19 threatens the health of people everywhere, but only in the U.S. will it also ruin patients financially. They're avoiding testing. That's what's going on, is a lot of people are deciding that they won't get treatment, even if they've got the disease, because they're worried they can't afford it. bear in mind also that we've just lost a bunch of healthcare. Something like 27 million Americans, they've lost their health insurance plans because their businesses had shut down. So that's a complete mess. 1 in 7 Americans say they will not seek treatment for COVID due to the cost. Wow. That's not going to help. That's not going to help. We need to have people be able to. So, David Royce, how many people died in the last 4 months to overdose? We've had 175,000 in the last 4 months. And by the way, that's based on behavior that they did not choose. I understand the sensitivity that many people do not choose to become addicted. And David brings this up all the time, and he's got good reason to, because he's lost a family member. It's a problem, but it does not far outnumber. It's less than half. It's still a disaster. And we will do an event on, we'll do a discussion on addiction, but that's not today. So let's stay on the topic of COVID, because COVID is the current disaster. It's the number 3 cause of death in the United States. And by the way, the number 175,000 they think is low, because there are deaths that we weren't anticipating that we can't attribute directly to COVID that put us over 200,000 unexpected deaths. Now, meanwhile, our health insurance companies are making money. United Health Group recorded its highest quarterly profit ever in the second quarter with a $6.6 billion haul. Even though the Affordable Care Act placed caps on health insurer profits and requires them to pass any extra profits back to customers through rebates, the companies are retaining their massive hauls. They've found some way, some loophole to do this. Patients, meanwhile, face significant out-of-pocket expenses related to COVID. So we are seeing some citizens are facing charges of thousands of dollars for dealing with COVID. So this is obviously a very, very serious problem. And so this is a problem that affects everyone. The way that we are dealing with this disease, we are not dealing with it properly. We're putting it off. Dr. Greg yesterday said that we can't expect, there is such a thing as herd immunity. The number he used was up to 60 million deaths. I believe he's referring to worldwide. But with us having the largest amount of deaths currently, that does not look good for the United States. So we need to take this very, very seriously. Michael Scapin is here from France. Michael, do us a favor and share it. Although I don't know what your French friends will think of all this. And Michael, maybe you could chime in with some comments about French healthcare. My understanding of French healthcare is that one of the things I like best about it is the concept of solidarity, which means the sicker you get, the less you pay. And I spoke to a friend from France about this, and he said it's true. He said, my dad was dying of cancer, and it took 4 or 5 years, and it was very difficult. But he said, once he got that sick, we never paid a bill. And we think it is barbaric that in the United States, you can lose your home, you can lose your family's, all your family's savings because someone in your family gets sick. And this is terrible. In France, they think this is barbaric, and they're absolutely right. You shouldn't have to lose your home because you get sick. And this means we will all be paying for each other's care. And I know some people don't like the idea of, I don't want to pay for someone else. Here's how it works, though. If someone in your family gets sick, very, very sick, and it becomes very, very costly, the rest of us take care of it. If we are all chipping into a system that covers these gruesome diseases, and you're one of the ones who pays into the system, but no one ever needs it because they never get the gruesome disease, guess what? You're the winner. You win. All you had to do was pay some money. Other people paid money, and they lost their loved one and went through the process of a gruesome, horrible disease. Yes, and we'll go on with more about that, but I think that would be a great thing to talk with Dr. Greg about. Let's go back to this slide. I think that's it. We're going to move on now to the story of the day, which is about the post office. Now, the post office has been a political football here in the United States. Never mind that we've had a post office in the United States or in America in the continent of North America. There has been a post office longer than there has been in America. There was a colonial postal services that became our U.S. Postal Service. And out here in rural America, the last bastion of the federal government, the thing you see most often is the post office. And they bring us packages, they bring us mail. And the attacks on the post office are going to fall more heavily on rural Americans. So that's obviously a very serious concern. There are a couple of ways that the post office has been attacked. One of them is that the post office has to fund their pension system at a much higher rate than any other organization in the United States. And this is meant to put a financial burden on them, to tie their hands. And it puts real problems on them. The next thing that has been going on, of course, there's been a lot of pressure from Republicans to privatize. They want to privatize everything that government does because that means if they're the owners of the business that replaces the post office, they'll get to make a profit. And they sure love to make their profits. Whether or not it serves the needs of the country seems debatable to me. But as we privatize more and more, to my mind, we lose a level of patriotism, a level of connectedness. If the post office disappears, we now have one more thing that we used to have in common that's gone. So I'm in favor of, yes, certainly reforming the post office. We've talked about Rich Campbell's idea of using the post office to be the provider for rural broadband. We've talked about that idea for a number of years. There are plenty of ways to modernize the post office, but now the idea of trying to cripple the post office during an election is questionable at best. Let's look at this. There's a picture, by the way, of our new Postmaster General, Louis DeJoy. And Mr. DeJoy gave millions of dollars over the last 5 years to Republicans. He's also got a business that that's somehow related to the post office and somehow related to Amazon. I don't have the exact facts, but it looks like he has a conflict of interest, and I believe there are some complaints being lodged by the House of Representatives to get him in front of an ethics panel. But that will be difficult during the time of the election. It takes a while to get through that. The post office is currently decommissioning 10% of its costly and bulky mail sorting machines, which workers say could slow the processing of election mail, according to a grievance filed by the American Postal Workers Union. They're decommissioning some of their mail sorting machines. So by decommissioning them, it's going to make it harder to get our ballots to us and harder to get them back to the courthouses in various places where they'll need to be collected in time. And I want to show you the map. Let's see if we can look at the map of where these are. This is where you're going to see the reduction. This is from, by the way, the Washington Post. And look at them. They're almost all big cities. These are the places that will lose their sorting capability. And big cities tend to vote Democrat. So look at these cities: Columbus, Ohio, New York, Philadelphia, Houston, Los Angeles. If you can cripple voting in those areas, we're going to see some real problems. And hopefully we're going to get this organized. But what this means to you as a voter, what I'm going to suggest to you it means, is that you don't want to lollygag when you get your ballot. You want to fill it out. You want to get your vote in. I spoke with a voter in Davis County who said, I'm going to just take my vote straight over to the courthouse. I'm just going to deal with this myself. So I think that's a great idea. Well, look, John Alma Barnett, who is from Warren County. John Alma is a friend of ours from down in Bowling Green. And John Alma used to work for the post office. So John Alma, we would appreciate any insight that you have about that. Now, next week, I want to let you all know John Yarmouth is going to be here. Let's see if we can get his picture up. John Yarmouth is the multi-term congressman from Jefferson County, District 3 in Louisville. And he's been a friend of this campaign. He's been a friend of mine. I'm very proud to know John, and I think we're very happy that we have at least one Democrat serving federal office in the state of Kentucky, and John is a wonderful person. He, by the way, apparently gives away his salary. So he's a hardworking, well-respected guy from Louisville, and he'll be on with us on Monday. Let's also get back here. So I'm going to show you now this video, and this is, like I say, from the Juice Media, and we've cleaned it up. We haven't. Rich Campbell has. I'm going to say goodbye. Thank you all for being here. Thanks so much. And I'll see you on Monday, 2:30 Central, 3:30 Eastern. I hope you have a great weekend. Remember, when you're getting angry, no need to act like a damn fool. You want to save up that anger and use it as a way to focus yourself to do what needs to be done, to help other people get out to vote, to get out there to vote, to make a difference for your country. It's going to be very, very important. Hope you enjoy this.
Hello, I'm from the U.S. government with an update on our pandemic response. In the space of just a few months, our "don't worry bro, it's just the flu" policy has gotten a ton of you killed. Some say this tragedy was inevitable, but actually, studies show that if we'd simply responded like other governments who listen to scientists instead of Chuck Woolery and the My Pillow guy, we could have prevented almost all of those deaths. Unfortunately for you, the amount of responsibility we take in doing our job comes to approximately all, which is why we got more of you killed than 50 9/11s. Trump 2020. With a president like this, who needs terrorists? As part of our distract from how many of you were getting killed policy, we'll be telling you the real threat to America is minorities demanding not to be murdered by cops. And to make you feel safe, we've deployed a secret police force to kidnap people off your streets without probable cause. Some call that taking a on the Constitution, but we call it law and order. Thanks to all the well-armed militias cheering us on, as we literally do the one thing the Second Amendment was supposed to prevent. What's that? People are looting in the streets? Oh, darling. The real looting is the one we're doing right here, as part of our exploit this crisis to funnel wealth from the poor to the rich policy. Like, remember when we told you COVID was no big deal, so we could buy ourselves just enough time to sell off our personal stocks before the crash which we knew was coming? Phew. Or when we passed the biggest bailout package in history, which funneled tons to corporations and easily forgivable loans. We even gave billions to churches bankrupted by sex abuse scandals. Even the I Love Small Government Rand Institute got some of the loot. But hey, don't forget that single barely above minimum wage check we sent you. You know, the one you simply handed over to your landlord to pay the rent, who in turn handed it to a bank to pay their mortgage, which is how we laundered another $1 trillion to banks through the working class. Profits made, profits kept. Now millions of you face homelessness, and 1 in 5 families are going hungry. But look on the bright side. Billionaires regained $500 billion of their wealth. We're not in this together. If you survive till November, be sure to re-elect us so we can get the rest of you killed in the looming climate and extinction crisis. You know, that other crisis we're ignoring and plan to profit from obscenely at your expense. Trump 2020. Of course, we realize that after lying to you, robbing you, and getting your loved ones killed, some of you might be contemplating not voting for us. But don't worry, that's why we've adopted our deregister millions of you policy, as well as our close polling stations, file lawsuits, and let's spread bull about voter fraud policy. And if that's still not enough, well, maybe we'll just cancel the election. Trump 2020. Now get back to work, America. Our stocks won't make themselves go up, you. God bless America, except Portland and Chicago. Authorized by the Department for Sacrificing School Teachers to the Great Bull God to make line go up.